Organised business is now urging lawmakers to consider aspects of the National Health Insurance Bill before committing to it. Business Unity SA CEO Cas Coovadia says that some of the key details are still outstanding. He joins us now. Cas, good evening to you and thank you very much indeed for your time. You say you support the principle of universal quality healthcare for all, but the current bill that is before Parliament, in your view, is it workable? What will happen if it's implemented in its current form?
Yeah, so we do support universal health care, but we believe that universal health care can be achieved with the optimal use of resources that are both in the public and private sector, in the health sectors. The bill as it is currently drafted talks about a single fund model, a fund run by government that will essentially have the monopoly on healthcare for citizens in this country and the funding of healthcare for citizens in this country. We believe that is unworkable. It will also, to a great extent, not create an environment for the inclusion of the private sector, private healthcare practitioners, private healthcare providers in the provision of healthcare to citizens in South Africa would limit that severely. And we believe that that's actually shooting ourselves in the feet. We've got a very good private healthcare sector. It has its problems and we need to deal with those problems. We have a public healthcare sector that also has significant problems and we need to deal with those. And we can only do that if we work in concert. And we have said in our article that we have experience of working in concert. COVID was one. The current initiatives we have with government supporting government in energy, logistics and transport, and crime and corruption is another. And we should be collaborating to actually, over a period of time, deliver universal health care to everybody.
One of the issues with the bill, as I understand it, as it currently is that it would probably lead to be funded, would probably need a lot more tax. You say it would lead to a big increase in VAT or a big increase in personal income tax.
Yeah.
We all know the issues on the fiscus at the moment.
Absolutely. So quite a long time ago, government itself calculated that they need about 300 billion rand a year. If one extrapolate from then to now, you probably need about 500 billion. There's no way you can tax for that. We have a very narrow tax base at the moment, too few people paying taxes. This will actually reduce that even further. And our fiscal situation currently is a perilous one. We can't even fund what we need to fund in social services and other services in the country. And that taxation, the income of the state is provided by a very narrow range of people. We need to actually broaden our tax base. That means actually get more people into the tax system. You don't do that by increasing taxes substantially. So we believe that government has not put on the table a viable funding plan for this, even if one looked at a single funding model, which we are very, very wary of and we don't support. And we believe that with slight changes to the current draft, which is going before the National Council of Provinces, with slight changes to the current draft, we can actually accommodate a significantly increased collaboration between the public and private sector to deliver universal health care.
You say slight changes. Is there any appetite from government, do you think, to implement these slight changes?
Well, Parliament did not show an appetite to do that. They passed the bill and they referred it to the National Council of Provinces. We will be lobbying the National Council of Provinces and we will be speaking to people in the department, including the minister, to put our case forward. We hope that they will listen to us. We believe that we have a reasonable case to put to them. We are not saying scrap the bill. We believe that the bill is a vehicle to get to universal health care, but we believe it is flawed. And if we don't actually make the necessary changes, I believe we'll be actually setting universal health care back instead of actually taking it forward.
Review from Cas Coovadia. Thank you very much indeed, CEO of Business Unity South Africa.